ACL injuries is something that happens to young athletes, and if the timing's wrong, it may affect their opportunities at elite sport. It may affect their development. They miss a lot of important development years in that sport. It may affect them financially in terms of what they can earn, sponsorship, their profile, and it may have long-term career affecting issues and then lifestyle affecting issues longer term. We also talked about the impact of this injury in the community, not just professional athletes, it's common amongst community level athletes. And my concern there, particularly in the female athlete, is what happens to their lifelong activity profile if they sustain a knee injury early on. In terms of the amateur athlete who's got a job, how does it affect their occupation, particularly the manual labourers and the like. So there are broad impacts of an ACL injury beyond just how much it costs to have an operation and the rehabilitation and the like. To help study how we can prevent injuries and rehabilitate injuries, we need to know how often they happen, and we can do that at the elite level, and we've got data that shows that in Australian women's footballers that ACL injury is 4 to 6 times more common than male injuries, and that correlates with what they see internationally. But we don't have data on what happens in the levels below that. We don't have data in sports like women's AFL. And so the idea of getting a registry is to try and capture all that data. At the moment you can maybe look at those who have surgery, but what about the ones that don't have surgery? What about the ones that aren't diagnosed? So we're missing a lot of these people. In order to study, we need to know what's actually happening and then how we can introduce some prevention type programs. And I wonder whether there's a change in our modern lifestyle, that there's less unstructured play when you're younger. So younger people lose that ability to have movement control and movement specific. When you're climbing a tree and you jump down from a tree, kids just don't do that anymore. You know, they have organised sport. So with the lack of those early movement patterns, I wonder whether we even need to introduce our prevention programs at an early age. And that's what I would be very interested in looking at. That's the ideal in primary school, that sort of level. You know, PE should be more about that sort of movements than necessarily about competitive sports.